The type of therapy we are going to be working on today is Constraint-Induced Language Therapy, or CILT for short. This is an intense therapy model based on the forced use of verbal oral language as the only type of communication, while any alternative modes such as writing, gesturing, or pointing are not to be used.
CILT's approach is very intensive, ranging from 3 to 4 hours a day. To shape the difficulty of the task, the required verbal actions are gradually increased according to the patient's needs.
The technique is a therapeutic language exercise closely related to everyday communication in the form of a card game, similar to Go Fish, where patients are given picture cards of which they have to ask for the match. The goal of the task is to collect as many pairs of matching cards as possible.
To adjust the difficulty level, the technique is introduced gradually according to the progress of each patient. So depending on the severity of the client's aphasia, the therapist can shape the difficulty level and expectations of the client's verbal responses. For example, a therapist can start off with a goal of just 1 to 2 word utterances and then can move to increase the sentence level as they progress.
Here we are going to see a group session between 2 clients with similar prognoses. Christina and Lanit are both Broca's aphasics that have difficulty with word retrieval and verbal expression. However, their comprehension is within normal limits. They've been working individually in therapy for 2 years. Their clinician, Nicole, has been in discussion with the 2 for about 3 weeks now about the 2 spending 1 session a week together to carry out this constraint-induced language therapy.
Hi, Christina. Who do we have here with us today?
Sister.
Hi, I'm Antonia, Christina's sister.
Nice to meet
She moved in with me after her stroke. I'm with her the most. We work together a lot. So we're here for this new therapy. Do you think it will be effective?
Today's our first day, but we're going to try it out. I have a really good feeling that this could be a very effective technique to use.
Great. So at home we work on reading a lot with her. She's been reading a lot better with more ease. I just feel she gets very frustrated with finding words that she can't, that she's thinking but she can't get out.
Yeah.
Well, so today we're going to trial this therapy, and this type of therapy works best in a small group setting. And I have a patient, her name is Lana. I think you two would be really great together, and I think it'll really help us progress with what we are trying to do. Would you mind if I have her join some of our sessions?
Yeah, good.
Would you mind as well, Antonia?
I think that's a great idea.
All right, great. I'm going to get her, and we're going to go ahead and get started.
Lana and Christina are going to be given 10 picture cards. The cards will be hidden behind their privacy folders. The key to this game is to ask each other for a card of their choosing and retrieve the word without gesturing or writing. Their goal is to have a double of each card in their inventory.
Go.
When conducting this therapy, you have a certain amount of cards that have a corresponding pair. The pair can either be categorized by color, a matching card, a minimal pair such as eggs and legs, or a semantic relationship such as to fruit. What you choose depends on the ability level of your client. For the purpose of this video, we're just going to be using matching pairs.
Hi, Lana. Hi, Christina. I'm glad you guys got a chance to meet. So we're going to go ahead and get started with our therapy for today. So we're going to play this game, and what's going to happen is you have these privacy folders to hide your pictures. You both have 10 pictures. We're going to take turns asking each other if you have the matching card. Remember that you can't use anything else. You can only use your words, so no gesturing or writing. The goal of this activity is to match up all of your pictures. Lynette, you're going to go ahead first, pick up an object, and ask Christina if she has that same picture.
Christina, do you have
Oh, no gesturing. Remember, use your words.
Christina, do you have the nose?
No, I don't have nose. I don't have nose.
That was great, Lynette. That was great, Christina. Good work. You answered Lynette's question. All right, Christina, now we're going to have you give it a try.
Lynette, do you eat breakfast, eggs. Do you have eggs?
Good. Now tell her, remember we can't use gestures.
I have eggs.
Very good. That's exactly what we're doing here. Great job. And you made a match, Christina. All right, Lanit, let's have you give it another try.
Do you have strawberry?
Go ahead.
Yes. I have strawberry.
Great work.
Note that Nicole advised against any gesturing or other compensatory strategies for word retrieval. This is the key of constraint-induced language therapy.
Hi, Lanit. Hi, Antonia. While Christina's getting ready, want to let me know just how she's been doing?
Great. It's been a very good day for her. I think she's really liking therapy a lot and she enjoys Lanit. I've created a little replica game mimicking the therapy. So she plays with my daughter as well.
Oh, that's great to hear. The more practice, the better.
Could I try to?
Oh, that's great to hear, Lanit. I can call up Leslie and we can actually talk about that today and I can explain to her how to do more of this therapy with you at home.
Leslie, sister.
Yes, Leslie, your sister. Since we've been making such great progress, today we're going to start with 15 cards that you have to make a match with. So today, Christina, you're going to go ahead and go first.
Lanit, do you have the orange juice?
I do.
Can you tell us you do have?
I have the orange juice.
Great job, you made a match. Landon, now go ahead, your turn.
Do you have the football?
I don't have the football.
Okay.
All right, Christina, go ahead again.
Do you have the cupcake?
I do not have the cupcake.
Well, you guys, even though you haven't made a match, you're doing a great job. I don't see any attempts to gesture, so we're making a lot of progress. Good work.
This therapy approach has been shown to improve expressive verbal communication when used with high intensity and dosage levels. CILT improves neuroplasticity by inducing activation in certain parts of your brain, as well as overall language function within a short period of time. Research has also shown that CILT has helped with improvements in narrative discourse and also shows successful carryover to everyday life.
There are also a few shortcomings to this therapy treatment. For example, the intensive nature of this therapy makes it extremely time-consuming and can possibly lead to fatiguing this patient. Fatigue can also occur because this therapy is very restrictive in the sense that it only allows for verbal use of communication.
CILT is used as a therapy technique for individuals who are post-stroke. The aphasia type and severity ranges from mild to severe. This therapy affects mainly different types of non-fluent aphasia, but can also vary across fluent aphasias. However, this treatment is not recommended for patients with global aphasia. Our group's opinion on this research-based therapy is that it seems to work with helping clients develop expressive verbal language as well as overall language skills.
What is still being debated is how constrained the therapy should be when it is administered. The traditional CILT involves the client focusing on verbal communication only, with no other non-vocal communication channels allowed. However, research shows that a less constricted version can also produce favorable results. For example, there have been cases where this therapy has been implemented, where gesturing and writing are allowed, and lasting progress was seen.